When I want to talk about cost and the impact of this legislation, and not just in the cost and these big numbers we're talking about, the cost of the program. What does the cost mean to people, the consumers of health care, those that don't have coverage, those that have coverage but watching premium costs go through the ceiling, and how's it affecting them? And we're going to have a couple of people talk to you here this morning. Dr. Akhter, Mohammad Akhter, who's going to speak to us about those issues, and a very generous consumer, Dana Tillman from Maryland, who's going to share with you her story about what she's been through. And as I just told Dana a few minutes ago, who's here with us, and is that she represents the face of an awful lot of people, millions of people in this country who wrestle every day with trying to manage their financial affairs in a difficult economic crisis with foreclosures and job loss and other matters compound the difficulty of sustaining the health care premiums and the cost of health care coverage is important. So I want to talk about that. I'm also going to tell you about the fact that we'll be announcing today, later this afternoon, the legislative text of the Health Committee bill. Not just a description of what we're going to do, but actually the text of a bill that we'll be considering. And I want to share with you as well the schedule we're on. We've been busy late last evening, in fact, almost all night, staff working to get the legislative language together, but the members themselves going through the areas of workforce, prevention, quality, coverage issues. We start again in about a half an hour, the full Democratic membership of the committee, going through that again with the goal tomorrow of actually beginning the walkthrough with my Republican colleagues on the committee, Senator Renzi and others, with a hearing on Friday and beginning a markup of this legislation on Tuesday of next week. So we're on a very aggressive schedule, and I realize that. But this is the single most important domestic issue that we've got to grapple with, and we've got to get going on it. We can't delay, in my view. You explained to Dana Tillman about delay, or expect to people across this country who have no coverage, businesses that are struggling with cost, that we're going to delay this. There is no delay for them. They don't get to delay their bills. They don't get to delay the problems they're facing, and they don't expect their Congress to be delaying on this issue. This issue cries out for a solution. Let me talk about costs, first of all, if I can, and state a couple of things that need to be stated over and over again. If you like the coverage and you like the plan you've got, you get to keep it. And I'm going to say that every day through this process. You like what you've got, you get to keep it in this country. We're not changing that. Secondly, we want people to have choice. You get to choose your doctor, you get to choose the kind of coverage you want. You're not going to have anybody in this town, if I have anything to say about it, it's going to demand or dictate to you who your doctor's going to be or what choices you want to make for you and your family when it comes to coverage. That's thirdly, we've got to deal with cost, and we're going to talk about that this morning. Cost overall of the program, but cost obviously to individuals and families who are watching the cost go up dramatically. Some 85% over the last 10 years. In my state alone of Connecticut, health care premium costs have gone up around 45% in the last 6 years, where it's becoming a staggering problem, getting close, I think, to $12,000 in every estimate that number could continue to rise in the coming years. And thirdly, in addition to the cost issue, is assuring a high quality, or affordable high quality health care for every American. Our economy depends upon it. You've heard these numbers, but they deserve being repeated. It's 17 or 18% of our gross domestic product, and there are those who predict that if we do nothing, those who are arguing for delay and those who are arguing about do nothing, that number could easily jump to 34%, according to economists who are looking at this issue over the next 10 years or so. That is not only unacceptable, it is completely unsustainable. We just cannot sustain that. The estimates that families could be spending as much as 50% of their gross income on health care premiums is just not sustainable. And so our determination to move forward on this is critical. We spend more than $2 trillion on health care every year. And again, it's the premiums and out-of-pocket costs for individuals continue to skyrocket. I mentioned the Connecticut numbers to you and the national numbers. According to a recent study, 49 million people, or 28% of the population, were paying off medical debt in 2007. That's up from 21% in 2005. Give you an idea how this is hitting families. Adults who experienced medical bill problems faced dire financial problems. 29% were unable to pay for basic necessities like food, heat, or rent because of their medical bills. 39% used their savings to pay bills, and 30% took on credit card debt to pay these. We talked about credit cards, obviously, last week or so with the credit card legislation. I've been hosting town hall meetings in my state. I know a lot of my colleagues are doing this as well. And they are story after story, 700 people, 500 people showing up for these forums. And even though we tried to define them around quality and cost and affordability and coverage, people came with their stories, wanted to talk about what they were going through individually. Met one cancer survivor who now pays as much for her health care as she does for her mortgage since her husband passed away from leukemia, a real estate broker, a successful one in Connecticut. Nearly 62% of bankruptcies in this country are due in part to medical bills. And again, Dana will share some stories or a story with you about her particular case. So the economics of this issue are compelling. Last week, you had the report issued by Dr. Romer at the White House talking about the overall cost to our economy as well. So those are the reasons that we're here this morning to talk about cost and what happens to individuals and the pressures on them, and to again emphasize the importance of moving ahead with the schedule that I've described to you. My fervent hope is, and I've had conversations with Mike Enzi and others on the Help Committee, is to get a bipartisan bill. I've said that, and I know that at this point here there's debate about whether or not that can happen. This is a beginning, and I think it's important to note that. This is going to be a journey that's going to go on for some weeks here. We're prepared to spend the time. I've asked my colleagues on the committee to set aside the time. The leadership has announced that in July we'll be here Monday through Fridays to work. I've urged my committee members over the coming weeks here as we try to complete our work in the Help Committee to be prepared to work Monday through Fridays on this as part of a markup agenda so that we're open, providing the time for ideas to be considered, options to be considered that are going to be critically important. On the legislation we'll introduce later today, there are some gaps in it, and done so intentionally. There are no gaps in our determination, in my determination, and that of my colleagues to have a public option, to have something done with the pay or play, to deal with the follow-on biologics. But I left those areas open for discussion, not because they're open for some sort of decision about whether or not we ought to move in that direction. But I want my Republican colleagues on the committee to know I want their ideas. I want to hear what they have to say. This is it's a bill. It's an opening step. We must, of course, under the rules of the committee, submit a legislative proposal 1 week in advance of a markup, so that if I wanted to begin that markup next Tuesday, as a practical rule requirement, I have to have a bill down today. But I wanted to put down a bill that was also an invitation to my colleagues in the committee to be a part of this process as we move forward. That's not a retreat from any principles. It's an invitation to be a part of this discussion and this debate as we move forward trying to deal with the issues that I've described to you already this morning. And I intend to aggressively pursue this. Now, my hope is, of course, Senator Kennedy will be back. I had a great dinner with him on Sunday night up in Hyannisport. We had a great time together. He was very anxious to hear about all the things that were happening in the committee and the long sessions we've been having in his absence, in his room, by the way, over here, a few feet from where we're gathering today, and where we've been meeting every night and during the day is to walk through this process. And he was strong, he was vibrant, we had a good meal together. He wants to come back to be a part of this, obviously, and that'll largely depend upon his doctors and how well he can come back and be a part of the debate. But no one wants to be back here more than he does, to be a part of this, other than me, possibly. Would like him back here very quickly as well. But in the meantime, he is just absolutely adamant that we go forward. As much as he would like to be here, he feels as strongly that we start this journey with a full acknowledgement and recognition that it's not going to be short, it's not going to be brief, it's going to require a lot of work. This is the only bill I know of in my almost 30 years here. In fact, I think you have to go back even further than that, where every single one of our citizens will be affected by what we do. Other bills, decisions to go to war or not, affect everyone, obviously, some more directly than others. This issue will affect every single one of our citizens for years and years to come. And so getting busy about it is important, getting it right is important. And you can't do either unless you start. And that's why I'm sort of pushing in a way that we get going on this. We're sitting at that table, we're listening to each other, and trying to craft what needs to be done. I'm very confident that there are a lot of areas where you're going to see a lot of agreement between the Finance Committee, the Labor Committee, the Health Committee rather, as well as on the substantive ideas. There are areas, obviously, where we've got some work to do, and all of you are aware of those as well as I am. But I've been around here long enough to know that you never resolve them unless you begin the process of trying to answer them. And you don't do that by just having countless meetings without having a product in front of you that allows you to debate and discuss the direction you need to go in.